We are thrilled you all could join us today and this week, especially to dive into some of the themes from the book, Next Generation Evidence, and to explore how we can harness data, evidence, and technology to achieve stronger and more equitable outcomes. My name is Kelly Fitzsimmons. I'm the founder and CEO of Project Evident, where our mission is to harness the power of data and evidence for better, more equitable outcomes. Project Evident partners with nonprofits, funders, policymakers, researchers, and school districts to build their capacity to use data and evidence to understand and improve their impact, support decision-making, advance R&D, and allocate resources towards stronger outcomes. We also engage in advocacy for policy and practice change that favors this approach. And we are increasingly working with practitioners and funders interested in how emerging technologies, including AI, can help make data and evidence more actionable, support decision-making, and advance mission attainment. Our book traces its roots back to 2019, when we held a Next Generation Evidence convening at the Brookings Institute in Washington, D.C. About 100 practitioners, policymakers, funders, and researchers gathered to discuss shared challenges and opportunities, spotlight successful strategies, and generate new ideas about how to make evidence building and use more useful and fair. As a result of the convening, we generated 5 core principles of next generation evidence and wrote a book with contributions from over 80 authors, some of whom are with us today. The 5 principles, which form the framework of the book, are that a next generation evidence ecosystem must first center practitioners, those doing the work, and the communities they serve, and empower them to drive their own evidence agendas. Secondly, it's essential that we connect equity with data and evidence, both in the way that evidence and data are built and used, as well as in the types of outcomes we seek to address. Thirdly, it's important that we elevate community voice and empower its members to shape and participate in the evidence-building process so that results are of value to those who most need them. Fourth, we embrace an R&D-like approach to enable timely and relevant continuous evidence building, overcome the old thumbs up, thumbs down that used to govern a significant amount of this work. And finally, we broaden the definition and use of evidence to be responsive to the operational context of practitioners and doers, attend to systemic and structural conditions, and prioritize decision-making and learning. We're so pleased to have a number of our wonderful authors with us today whose work exemplifies these principles. And we're going to kick off with the fireside chat, sadly without the fire, with Michael Smith. After that, I'll hand things over to my co-editor and co-conspirator in this work, Tamar Bauer, who will moderate a panel with Carrie Seahawk, Garrett Warfield, and Pete York. We would love to hear from you too, and we'll have time for Q&A after both the fireside chat and the panel discussion. We encourage you to ask your questions using the Q&A function. We'll be monitoring throughout, so drop them in whenever. And now I'm pleased to invite Michael to join me. Hi, Michael.
Hello.
So good to see you.
It's good to see you as well.
Before we jump in, I am going to take a moment and share your bio for the very few that have joined us that don't know you, but your contributions to this work in this field are just tremendous. So permit me. Michael Smith is the Chief Executive Officer of AmeriCorps, the federal agency for service and volunteering. Michael has dedicated his career to social justice by reducing barriers and expanding opportunity for children and families in underserved communities. He first served as Special Assistant to the President and Senior Director of Cabinet Affairs in the Obama White House, where he designed and led the My Brother's Keeper initiative and federal task force. He went on to continue that work as Executive Director of My Brother's Keeper Alliance and Director of Youth Opportunity Programs at the Obama Foundation. In 2021, Michael was nominated by President Biden and confirmed by the United States Senate to serve as CEO of AmeriCorps, where he has sharpened the agency's focus on equity, investing in what works, and uniting communities through the power of service. Michael, thank you for being here with us today. I love your body of work, and I love your chapter, Systems Must Change, Dismantling, Disrupting, and Reimagining Evidence. And I'm excited to dig in to some of the ideas. So let's get started.
All right.
You open your chapter with a reflection on a TED Talk that you gave in 2014, a decade ago, and discussed how your views of evidence have evolved since then. Can you share more about this shift and how it influences your current work?
I will. First, let me say, Kelly, thank you for your work, your leadership, for you and Tamar asking me to be a part of this. You all know who have done any writing how long it takes to put together any sort of book. Nevertheless, when you are bringing together a lot of different authors, and so I just want to thank you for your body of work and for the way that you have taken this conversation to the next level. I also just want to thank everybody who's joining us. I was talking with the organizers before we started, saying when we planned this a couple months back, we knew it was going to be a couple days after the election. And we knew half of the people maybe on this call would wake up celebrating and half of the people would wake up with knots in their stomach. And so I just want to thank you, no matter where you are on that spectrum, for joining this conversation. And I want to say, you know, I'm a political appointee. I work for President Biden and Vice President Harris. And so this has not been an easy week for me or past couple days. But one of the things that keeps me going is the work that we get to do together. No matter the results of the election, we need AmeriCorps members who are going to show up to help the folks that are dealing with Hurricanes Helene and Milton. Our urban tree canopies, our forests, our rivers need restoration. They need people to take care of them. Our kids need tutors, mentors, and coaches. And so I'm just grateful that I get the opportunity to work with people like you and folks that are joining us. No matter elections come or go, but working on this idea that we are building that moral arc towards justice and that we continue to do that work regardless. So I just wanted to say that to, you know, address what we're, you know, is in the backdrop of this conversation that we're having today.
Absolutely.
So Kelly, you asked me about this shift that I had. So
Yes.
it was interesting. I had given this TED Talk back when I first started the Social Innovation Fund. And, you know, we all hopefully have a growth mindset and we learn and we grow. And it's just where I was at the time.
Yep.
And I gave a TED Talk about the importance of investing in evidence-based approaches. And I centered it in my own personal experience and why this evidence work was so important to me. And I talked about the community that I grew up in, a low-income community in Western Massachusetts. I talked about how in my neighborhood, there were about 8 different nonprofits that were all working to serve low-income youth like me who may not have had enough access to opportunity. And I talked about, despite the investment, how the stats were not changing for kids that looked like me. I think that year, the murder rate in my city was going higher and higher for Black and brown boys. I think my city had been the second most dangerous city in the Northeast per capita at that time. And I talked about how we continue to funnel money into these nonprofits, where at that time, I think there was data that said something along the lines of 1 in 8 nonprofits spend $0 on evidence building. And I think about 52% of nonprofits didn't even have a theory of change or a logic model. And so to me, that was my rationale for saying why we need to invest in nonprofits, invest in evidence. Because maybe if those nonprofits were investing in evidence and they weren't having their own separate galas and patting themselves on the back about the individual things they were doing that look good, maybe they would invest in evidence and we can actually see the level of impact. And I went on to offer some solutions and all my grandness and glory as the head of the Social Innovation Fund, all of my experience. And I said, we need to stop investing in nonprofits that don't work. I had worked for President Obama launching the My Brother's Keeper initiative. And when he launched My Brother's Keeper, he said, we have to have the good sense to stop investing in things that don't work, which we do too often. And so I said, you know, we should stop investing as individuals. I said that philanthropy should know when to walk away. And I talked about this idea that we needed more mergers and acquisitions. So maybe those 8 organizations would come together and think about evidence-based models. And for me, it came from a good place. I wanted to end this Hunger Games where nonprofits were competing against each other, and maybe we could bet on the winner. And I had gone back. Someone had sent me a note, I think on Facebook or something, saying, "I watched your TED talk. It was amazing. I'm using it to teach my nonprofit class." And so I went back and watched it, and I go, "Oh no, don't do it. I don't know if I believe this anymore." And so as I went back and I watched it, I realized that I had put all of the blame on the nonprofit organizations that were doing their best to work within a system that left them underfunded, that left them with challenges that had been created structurally long before them. And I didn't think about the systems that were in place. I didn't think about the investment that was needed. I didn't think about the challenges that they were facing. And so that it really created a shift for me from going into the very beginning of leading the Social Innovation Fund to working alongside these organizations that were trying to scale, then going on to doing the work of My Brother's Keeper and working with small nonprofits that were doing their best to try to help these communities stay together.
Michael, thank you for sharing that. And at some meta level, you're sharing your own learning journey of a data and evidence journey, like your own R&D process in this, which is very much what we're trying to get hearts and minds to open up to, is we want to hold the value of evidence, but think about how to engage with it differently. You make a strong statement in your chapter, and I'm going to share some of your words back to you. And I know that can sometimes be cringy,
let's see if I still agree with myself. But go ahead.
We might have another learning and evolution moment. But you call on us to expand our understanding of what constitutes evidence, to grow our tent so more diverse voices and perspectives are included, and evolve our concept of what classifies as an evidence-based solution from solely programs that meet immediate needs to policy reform that dismantles, disrupts, and reimagines the broken systems that have failed far too many. Can you elaborate now for us on what forms of evidence we should be paying more attention to collectively, particularly in the context of advancing equity and dismantling these systems that contribute to oppression?
Kelly, thank you for that. I still agree with all of those things that I say, which I think at this point was probably written almost 3 years ago. So maybe I'm getting to a good place. There are a couple things I think about. There are 2 stories, experiences that I had that stand out in my mind. One, when I was actually running the Social Innovation Fund, the Social Innovation Fund was designed as kind of a response to an Obama campaign promise on how could we move more dollars to help prove and improve concepts while growing them and scaling them to other places. And so we were at the Corporation for National Service, which is now called AmeriCorps, but we weren't a national service program. And I remember early on, I was asked if I could come to the National Service Conference and talk to AmeriCorps' grantees about this evidence idea, because it was just beginning to catch on. And I remember thinking, no one is going to come to a session to hear about evidence at the National Service Conference. I've been there before. I don't think it's going to happen. And I get down to this conference, and there was a line out the door to come to this room. And it turns out that many of these grantees, smaller nonprofits, some national nonprofits that have affiliates across the country, they were beginning to hear more and more from their funders that if they did not have an evidence-based model, if they didn't have theory of change, if they couldn't talk about the impacts that their work was actually having in a measurable, tangible way, that funding was going to slip. And they were scared. They didn't know how they were there. Many of them were struggling to meet payroll. Nevertheless, figuring out how are you going to hire MDRC to run a study for you, And so we sat and we talked and we thought a whole lot about it. And I remember what came out of that experience for me, and an area of evidence that I think we need to focus on is just getting people on the journey. And that was a hallmark of the Social Innovation Fund, which has actually become a part of the DNA of the Corporation for National Service, now called AmeriCorps, where now about 70% of our grantees, we invest about $1 billion a year in thousands of nonprofits across the country. And about 70% of our grantees now have strong or moderate levels of evidence. And the reason that is because we talked to them about an evidence ladder. We talked about, we can start with pre and post tests. We can start with the theory of change or a logic model. We don't need everyone to get to a randomized control trial. We just want you to ask the question about what will it take to get to the type of impact that you want to have on a community, and how do you know when it happens. And so that was one thing that really colored my thinking. Another story actually happened rather recently. AmeriCorps has a nation-to-nation commitment and a federal trust responsibility to our tribal communities. And I remember being at one of our first Tribal Nations conference. And one of our grantees stood up, I think rather courageously, to talk to the head of the agency and say, you all are investing a whole lot of money and attention into this evidence-based approach. And she said to me, who gets to decide who owns evidence? We've been doing this work from time immemorial. Are you telling me that I have to go to a university in New York or California who's going to tell me what works in my community? That's the level of evidence that I need to, and that convicted me to really start thinking about investing in community-owned evidence approaches, allowing community members to be a part of that journey at the beginning, and not saying that someone has to come from the outside of the community to build those strategies. And the last thing I think about is just this mixture of storytelling and evidence. You got to have both. You have to have the data and the evidence to back it up, but you also need to have some proof points. And having those proof points inspires and brings that data to life. I think if any of our nonprofits only had researchers that were only doing evidence and didn't have communications and marketing people that were bringing, Johnny in, who is an example of how this evidence is working, then we would not be able to capture the hearts and minds and imaginations of individuals to think about further investing in these solutions.
So I want to stay with your ladder metaphor and just notice the call to bring others in to co-design the ladder in the first place. It's not just set by one party. It sounds like there's a lot of movement to co-design that ladder. And then within that ladder, adding more rungs than we traditionally have. So they're getting started and pre-post counts, but it also sounds from the progress that you shared, the movement towards, rigor throughout, that the movement towards progress and stronger outcomes is enabled with this type of co-created laddering, more rungs, and this broader inclusivity of method and member.
That's right, and more support. We've been able to help our grantees move up that ladder. It just isn't an expectation. We've actually invested in it.
Which is a huge shift, rather than there it is, go climb it yourself.
Exactly.
Okay. So then building on that, what is your advice for and how public agencies and nonprofits can effectively integrate these types of evidence, including, as you shared, the qualitative insights and lived experience, into their evidence building process? You've certainly now helped a large number of organizations build this capacity. You've done it yourself. So what's your advice to them as they think about integrating into their own evidence building processes?
I have two thoughts on this. One, I believe Results for America, which has the I can't remember the name of the award, but I have it on my mantle over there. A certification that they do for federal agencies on the evidence journey. I think there is a goal about spending 1%, I believe, of your budget on research and evaluation, which we are doing. And so there is this idea that if you want me to see your values, then I will show you my budget. If you want to see what I care about, then you see what I pay for. And so I think the first thing is you just can't talk about it. You actually have to show the investment. When we launched My Brother's Keeper, President Obama was very clear he didn't want to have a conversation about race. He said to the American people, he said, young men of color in this country need to know that their country cares about them and is willing to invest in them. And so I think when we think about this evidence journey, not only nonprofits, but philanthropies that are doing a lot of talk about the importance of evidence-based models. need to be willing to invest those dollars to make sure that these nonprofits and social impact organizations and federal agencies can actually build out that evidence. One of the things I was really proud of when I was running the Social Innovation Fund is our grants were really large. They were a minimum of $500,000 and they could grow up to $10 million. And our grantees were spending about 30% of their budget on research and evaluation because they had the goal of both proving and improving the model, but also scaling. And we said, we want you to spend this type of money to build out the evidence and then spend the rest on the scaling work. So invest, invest, invest. Don't talk about it, invest in it. And then the other thing I have to say is just this idea of nothing about us without us. You have to have the right people that are in the room. I cannot tell you how many times I have been in a meeting of social sector executives who talk about the importance of listening to communities, that have a conference, that have community members that sit on panels. And then I look at their boards and everyone's from Harvard and Yale and have been at this, in their organization for 30 years and haven't touched the communities that they're trying to serve in maybe 30 years. I tell people all the time, I grew up poor, but I haven't been poor in a long time. Thank God. I've been blessed, right? And so even though that's a part of my journey, and I think it's important that I bring that lived experience to the story, I still at AmeriCorps have to make sure that people that are living every day and the types of abject poverty that many of our communities are helping to influence our decisions. So what does that mean? That can't just mean someone that's at your conference. It can't just mean someone who's giving you a tour of the nonprofit that you're visiting. That means, what's your pathway to diversify your board? Not only your board, but your board leadership. What's your pathway to diversify your leadership within your agency or within your nonprofit? And there are ladders to doing that. I've seen residents or community members in residence, entrepreneurs in residence, activists in residence as a way of starting that. I've seen community boards. I know one of the things that we've done at AmeriCorps that I've done in past jobs is creating panels of folks that are designing the notices of funding and what the requirements are, and that's being driven by the people that are going to be beneficiaries. And so I think that's where you have to start. If you want to develop solutions that are going to impact the community, then that community needs to be a part of the process from the very beginning.
Absolutely. I could not agree more. And I'm going to follow on your positive energy that you're putting forward, to also say that your chapter paints an optimistic vision for the future of evidence. And if you take your magic 8-ball out for a moment, looking ahead, give it a good shake. What is it you think social sector leaders in government should be thinking about in this moment, and the role that evidence and data can play as we move forward?
And talk a little bit more about when you say this moment. What do you mean this moment?
So we've been talking largely, I'm not trying to ground in the current political context. To be clear, so we've been looking in the rear view a little bit. What have we learned in the past? I'm going to give you a little spoiler alert. There's a question coming up about your future learning edge, since you've shared so much about your past evolutions. But as you look out at the future direction of the field, whether it's some of the policies, some of the current issues that that are top of mind for school districts, for students, for communities, advent and rise of technology, assuming that optimistic stance, curious then what you think at some level the next generation of evidence will likely look like.
Yeah. Well, I would go back a little bit to one of the topics you had brought up when you were quoting back some of the things I had said in the article. One, this balance of program and policy. I think that it's still something that the nonprofit sector struggles with. I think philanthropy sometimes has not been helpful there. I'm happy to see some really good examples, like, for instance, the California Endowment that have done such a beautiful blending of program and policy, realizing that if we're not careful, we can be handing out coats and serving soup forever. And if someone is not going back and getting to root causes, getting to systemic
Yeah.
solutions, and then thinking about policy changes that are going to impact those issues like hunger and homelessness, like chronic absenteeism, like environmental challenges, then we're setting up a cycle where we're never going to get to a solution. So how does evidence begin to evolve so that we are encouraging and better understanding the organizations and the institutions that are doing a good job of blending those things together? And so I think that is certainly one space. And I would say the other piece, just given where I am this week, is how do we bring people together? And one of the things that I love about AmeriCorps is through service, it allows you to see other people's humanity. We have social isolation. The Surgeon General talks about a loneliness epidemic. We have seen the echo chambers that exist, not just after an election, where people are disappointed on one side, winning on another, but people are living in these deep echo chambers. There was a study that came out that showed 72% of Americans believe that we are so divided that we can no longer solve big national challenges anymore. And that was almost a 30% increase from less than 10 years ago when that survey had been run before. But what I know as an AmeriCorps and anyone who's been around service at any period of time, it brings people together. When you're mucking and gutting a house after a hurricane, when you're teaching a kid how to read, people don't care what color hat you're reading. They don't care about your ideology or your religion. They just want to get things done for America. And at AmeriCorps, for instance, we've seen evidence and data that shows us about 72% of our alum, first, about 90% of our alum said that they are more comfortable working with people from different backgrounds than they were at the beginning of their service, and 72% say they actually had a belief that was changed as a result of their service. When does that happen anymore? And certainly would anyone admit it? And so how are we investing in better understanding what it will take to bring people together? Because if we don't figure out this polarization, if we don't figure out this division, then our ability to solve problems at a micro and a macro level are going to be seriously inhibited for the long run.
Right. That's such an important call to action. And this, evidence is a facilitator of connection, but the intent to try to connect in the first place, and your framing earlier, which I know my colleague Bivong, who runs our work with education agencies, would be all over root cause analysis for systems level solutions to inform policy change. And I think that that cohesiveness, so coherent thinking, we've got to get out of incremental and start to think more broadly this way. So really appreciate those comments.
And those who hold the power, largely philanthropies, government investors, we need to tell those that we're investing in that it's okay to do that. Many organizations can spend up to a certain percentage of their budget actually on lobbying. You can actually spend a certain percentage of your 501c3. Nevertheless, the idea of creating a C4, nevertheless of educating versus advocating. And I think many of us that are in charge of investing in these organizations have put a freezing effect because of a risk aversion to what might be out there. But we have to figure out a way to make sure that people closest to the pain are closest to the power. And if that's the case, that has to be about systemic solutions as well.
Yeah. So it's actually okay and in fact needed for communities to tell government what works for them and how to get it. Okay. All right. On that note, I'm going to open up for some questions.
Okay.
And I've got one here also from Carrie, who's on a panel, and Carrie Sehawk, who also sits on the advisory panel at Results for America for that award that is sitting in your desk. So just want to draw a connection there. And Carrie's sharing that she really loved and appreciated hearing your reflection on your own growth and mindset shifts. And as you think about for yourself, now you just shared some pieces for the field, as you think about for yourself, sharing a little bit more of what you think your next learning edge might be.
Oh my goodness, there will be so many. What is the idea of a shark? I don't know if this is an old wives' tale, if it's absolute or it's true that if they're not moving, they're not living. But I believe that there has to be this constant evolution. That's how we survive. We try to hold people, and you had this belief. Why don't you have it anymore? Because I'm human and I'm growing and I'm evolving and I've learned something and I've fallen down and I got back up again. I used this tool, it didn't work, and so now I'm using a different one. And so I think we all have to be in this constant state of introspection. We have to all have our own evidence review. Did this solution work that I deployed? How is this idea playing out? And so I know I'm going to be at another moment coming out of leading the National Service Agency. And, we had thoughts and ideas and solutions, what worked and what didn't work. So I imagine if you talk to me 3 years from now, there might be beliefs and ideas that I hold today that I hope I don't hold 3 or 4 years from now, because I've learned something new and I've evolved. But I think we all just have to give ourselves that space.
I have a few questions here, and so I'm going to build on the giving of space and connect that to a question here about how we might continue to help organizations continue centering on equity and evidence in the current legal context or political moment when there might be targeting by activists or litigation or loss associated from holding up some of these ideas and principles. I'm going to start with the tough one.
Woo!
Yeah.
I am still a political appointee, so I'm gonna
Yes.
ask me in a couple months, and I might have a more direct answer. But here's what I will say. There are words that are trigger words: climate, CRT, DEI. But at the end of the day, people on both sides of the aisle, for instance, on both political ideologies, know that diverse teams, diverse C-suites, diverse boardrooms actually lead to more profitable companies. When I was doing the work of My Brother's Keeper, we really talked about the economic imperative. And so President Obama would talk about the idea that we have a moral obligation to make sure young men of color can achieve their dreams. But he also would talk about an economic imperative. The President's Council on Economic Advisors at that time put together a study that showed if you were a baby black boy born 25 years ago, you had a 1 in 2 chance of being employed at that time. And if we could close, though, the labor force participation rate between young men of color and their peers, we would see an increase in the GDP by 2%. So there might be hot button issues that people get upset about, but here we go back to fact again. There's not going to be anybody that agrees that, America is driven on supply and demand. And if we do not have a robust workforce, if we don't have diverse workforce, if we don't have opportunities for people to enter the economy at multiple levels, then our communities, our country will not be successful. And so I think you just may need to shift the way that you're talking about it. I'm not saying that means we should be celebrating some of the decisions that have come down. I think that means that we have to go back in boardrooms and say, what is it that we're trying to get done at the end of the day? And if we can no longer talk about it this way, how are we still getting it done? And we have to be hyper vigilant about that. I know, for instance, since we've seen some of the decisions about affirmative action, we've seen significant reductions in enrollment at PWIs of Black and Brown students, even though we had spent a lot of time talking about the fact that you could also use income, you could use zip codes, and so we have to still continue being hyper vigilant about what those things are, but don't give up. Civil rights still exist, equity still exists, and there are reasons why people of all sorts of ideology need our nation to invest in those strategies.
Michael, thank you for that. We are unfortunately at time. I have a handful of other questions, but we maybe follow up and we could share back some. So I think that's just that's a reflection of the deep interest in the experience and the thoughts that you have to offer. We are so grateful to you for making time for us today. I know this is an incredibly busy week and an incredibly busy year and an incredibly busy run that you've been having. We are so grateful for you and for your leadership and just appreciate your vision for what evidence and justice can be for us all and for communities across America. Thank you.
Kelly, it's wonderful to keep finding ways to work together. Tamar, everyone else, thank you so much. Look forward to staying in touch.
Take care. Bye now. And Tamar, over to you.
Thank you, Kelly. I'm so moved by what I just heard. That was a fantastic conversation. And now I'm thrilled to welcome our panel to the continuing conversation. 3 more of our NextGen evidence authors. Please join me on camera. This panel will focus primarily on the first principle, centering practitioners and the communities they serve, although all panelists' essays really touch on all of the principles which overlap in practice. The author bios are available, I'm going to do this, in the book, starting on page 437, so you can look at them there. But I'm going to take inspiration from Michael's story, and I'd like to ask each of you to share a little bit about what brings you to this work. Maybe there was a NextGen evidence pivot, maybe there was an aha moment from your career. Just let us know a little bit about what brings you to this work. We'll start with Pete, then go to Garrett, and then Carrie. Pete?
Sure, and this is not where we're talking about the detailed yet. This is just a high level, right? Yeah.
Just a high level intro, like what brings you to the work. We'll get into the nuts and bolts in a minute.
Yeah. So what brought me to this work is that I'm a former social worker from the front lines. I worked in patient psychiatry with kids. I was working for the homeless. I was a caseworker for the homeless. Then I became an evaluator, and I just always felt that the work that I had done in evaluation was very valuable. For funding and decision making and policy making and that type of work. Oftentimes the type of evaluations wouldn't have the results of those evaluations wouldn't always have reached the front lines and have been as practical. Because one thing I knew when you're on the front lines of service delivery and you're doing this work on the ground, it's not one size fits all. And a lot of our evaluation tends to roll things up. And I think if we're really going to benefit the practitioners and more specifically those we serve and the beneficiaries, we really need to figure out how to bring that back down. And so really I've been spending the past over a decade now learning how we can use the tools of machine learning and AI to really start to bring those kind of data insights, not just for the purposes of helping us evaluate and generate evidence, more broadly speaking, but actually bring that evidence and insights right to the practitioners and those they're serving in a more customized and more tailored way, which I saw the opportunity in AI and machine learning. And so that's what brought me to this work. And I think there are ways that we can do this now, and the technology is remarkably advanced in that regard.
Thank you so much, Pete. Garrett?
Hi, everyone. Folks who know me well have heard me say this before. I came from a family that fortunately had a lot of love, but was deeply and profoundly broken by poverty and addiction. I was the beneficiary of virtually every social service you can imagine growing up. And while I must admit there's a careful balance here, part of my motivation towards this field was selfishly to understand why my family had such struggles. But in balance with that was cliche but true, a deep driving desire to pay it forward, all the ways that I was helped and supported. And admittedly, sometimes the help was really helpful, and sometimes the help hurt. And my motivation towards coming into this field was largely to understand under which circumstances the help helped or the help hurt. And to optimize and maximize its value to beneficiaries, folks who would get to experience that help along the way. My career then led to over 20 years as an applied researcher and evaluator, the last 10 of which as the chief research officer with Europe United, based here in Boston. And I must admit that next week I am stepping into a new role with the National Recreation and Park Association as the Chief Research and Impact Officer. Thanks to so many from both the Europe United and the NRPA teams who are here on the call today. I'll get to share a little bit more later about what some of that work and practice has looked like towards meeting those original goals about understanding where I came from and helping to pay the best stuff forward.
Congratulations, Garrett. Carrie?
Yeah, hi, it's great to be here with you all on this panel in this conversation. It's really bringing me a lot of energy, so I appreciate that. I serve as Equity and Impact Officer in King County, Washington. We're the 12th largest county in the country and have a really amazing, diverse population. Includes City of Seattle, 38 other cities, a big rural area, large urban unincorporated area, and it's an amazing place where I found a lot of belonging here. As I mentioned in my book chapter, I'm trained as an economist, but I really consider my most important education as having come from working with that diverse set of communities here in King County. And, I loved hearing Michael talk about his growth mindset and how his views have changed over time. And it's certainly been an evolution, a continuing evolution for me too. So early in my career, I think I was pretty guilty of the assumption that communities weren't really interested in data and evidence building, and that we had to think about equity as maybe separate from data and evidence. And in working with our communities throughout King County, I've really found that to not be true at all. Communities themselves are deeply interested in data and evidence about their community. And it's the communities themselves who really have the biggest stake in making sure that interventions work well. And they cared very deeply about being part of activities that are working to make things better. So a lot of my career has been focused around outcomes and culture change, a culture change around integrating equity, integrating evidence and outcomes into what we do. And I'm really motivated in that by, the connection that I've had with our communities here in King County. It's been amazing and very fulfilling.
Thank you so much, Carrie. I'm going to stay with you, but all of you will get the same question. Each of your chapters describe the shifting power dynamics in evidence building to center practitioners, the doers, as we sometimes call them, and the communities that they serve. Can you tell us a little about some specific strategies that you have used and that have been most effective for ensuring that evidence actually meets the needs of frontline staff and program participants?
Yes. And again, I'll give you a little bit of a highlight from my chapter in the book, but there's so many chapters in the book that I've learned from, so really encourage people to take a look at the book. Sitting in a local government seat, I really reflect on the myriad of roles that local governments play. So we're funders, we're policymakers, we're program designers, we're implementers, and we're evaluators of both public sector programs, public sector services, but also systems. And so I really feel like we need to, as local governments, step up and leverage this multiplicity of roles that we play to center both equity and evidence building. So, if you think about how we go about, launching a service, and I think this holds true whether you're, in the nonprofit sector or in government, but we would never think of launching an intervention without a well thought out budget, an implementation plan, a communication plan, and increasingly measurement plan, right? Well, we need to extend that practice to include planning explicitly for both equity and evidence building. And we need to be really focused on outcomes right from the beginning. And we need to bring community in to help us think about what outcomes are important to them and what outcomes we could expect from the things that we're planning to implement. So, really explicitly thinking about equity and evidence building from the beginning is important so that we can really identify the most important questions that are going to inform our future decision making. We need to review evidence and best practices from other places. We do spend, quite a bit of time looking at best practices from around the country. We can do more to look at what evidence has been built. And we need to also, working on thinking about this mindset from the very beginning helps us ensure that we can design and collect the data we need rather than work with the data that we end up having, as we often do. And we can make sure that we're building in the right set of skills and a diversity of perspectives to deeply inform our learning. So I often think of bringing together program staff who have deep expertise about navigating a bureaucracy, understanding program and implementation, bringing those program staff together with sometimes external researchers and also, really importantly, community partners. And it's all together, like those parties together should be identifying the outcomes, building and executing the learning plan, really importantly, analyzing the results, and then figuring out together, what does that imply for how we shift so that we can do better? So, we've got a couple of examples where we've done that in King County. They're mentioned in the book chapter, so I'll be really quick in just highlighting them here. But in our initiative, Best Starts for Kids, which is a voter-approved, voter-funded initiative to make every child healthy, happy, safe, and thriving, we really designed that initiative by starting with the outcomes and engaging community deeply in design, and then investing in our community partners to be able to use data and evidence and help us build it together. And that's investing both dollars and technical assistance. And it also started with a really strong equity focus. A second example that we have here in King County of doing that work from the very beginning is we pulled together a diverse set of folks into what we called our Metro Transit Equity Cabinet. And this was a group of people who we invited in to really help us rethink how we're providing public transit service and shift our focus from not only being an excellent provider of bus operations, but also thinking about how we deliver on the outcome of transportation mobility for people. And by bringing those folks into our decision making, starting to share some of the power in that decision making with them, it really shifted our perspective on outcomes and how we think about the service, and that's playing out in so many myriad of ways. So I'll leave it at that, and I'm sure we'll have more conversation.
Thanks, Carrie. Pete, same question for you. Specific strategies that you found most effective at ensuring that evidence meets the frontline needs.
Great, thank you. So I'm going to speak to the chapter that I had pulled together for about GEMA services. And so we're going to really talk about how we can start to bring evidence in this kind of additional way in terms of thinking about AI and machine learning and where it can start to take us to really bring evidence to those front lines. So let me just start with a problem here. GEMA Services is a residential behavioral healthcare provider for children. That's not the problem. The solution. They're the solution. But like a lot of organizations and providers, there's large amounts of data, and they were really struggling to use that data effectively. So many organizations are now getting richer and richer in program administrative data. The challenge was that with that data, it really wasn't, there was a lot of data gathering. Practitioners had to extract information and input it into the system. But you didn't see a lot, as they put, there's a quote from a staff member, we were putting a lot of data in and getting nothing back in return. Mm-hmm. This has been a problem for a very long time. They were the leaders there were very inspired by how Netflix and Amazon were using AI to predict user preferences. That's a high level example, right? We all experience in our lives. But there were also successful predictive models and evidence beginning to see how we could use these tools in juvenile justice and child welfare. And so they really wanted to turn to data analytics to see if finally we could give the practitioners and empower the practitioners and the beneficiaries, specifically the children in this context, with information that we couldn't before. So they wanted to apply what I'll call kind of causal modeling or precision analytics. These are training AI algorithms. It's quasi-experimental. It actually is evidence-based, but it's doing something that we don't do in traditional randomized control trials and other types of evaluation efforts. We don't really look to kind of the real world experience to see what's happening, in the real world data in order to learn kind of what's going on there. So it's a quasi-experimental method, and what we are doing is training algorithms using that data to discover what works for whom and under what conditions and circumstances. And the point here is that it's really trying to build in a sense of fairness and reduce biases, very specific kinds of biases. It's doing that by basically acknowledging something, that it first has to find cases that are very similar in their context, their situation. For example, children that had attention issues are not going to need the same things from their programming and their services as kids that were developmentally delayed. Trauma adds another dimension. A history of trauma could add another dimension to what a child might need. So the first thing that's really important if we get out of the one size fits all is to be able to begin to use these tools and algorithms in a way to begin to find similar cases like me, so to speak. And then, as we all know, when actual programs unfold, you may be very similar to other kids that are very similar in circumstance and situation, but in fact, we know that not everybody gets the same treatment and the same interventions and the same dosages. Those are like nature's natural experiments. And so what we're doing is actually using AI to go in and find out when certain types of kids, let's say kids with attention deficit problems and some trauma in their lives, if they actually are receiving certain types of treatments, protocols, interventions, therapies, we can see where some did and some didn't just by virtue of maybe their insurance didn't cover it. That creates a natural experiment, right? And so you can leverage those natural experiments to figure out what's working. And so there's a real opportunity in sitting in those data to be able to really start to leverage this data. And it's all there. So much of the government funding and philanthropic funding has been tracking and monitoring outputs, monitoring that you served, you delivered the services. Well, inherent to those data sets is also oftentimes assessments, which can relate to outcomes, and other kinds of data, intake data, content. So we can start to build our logic models off of this data that we've already been tasked with gathering for output tracking and monitoring, and being able to just make sure we're doing what we said we would do, leverage it for other purposes to bring it to the front lines. And this brings us to the real transformation, because once that data is modeled and the algorithms can figure out what works for whom, which is like finding those little experiments, it can evaluate for those that want to know how we're doing. Are we creating a statistically significant difference for each of these groups? And can it also tell something, if we automate it with technology, can we deliver insights in real time to practitioners and beneficiaries and their families as to what's working and how we're doing on what's working and what are some of the challenges? Even when it's not always, and it's never going to be perfect, it's probabilistic. Even when it's not certain and a clinician says, well, some of these things are needed, but we think we need something else that's not in the data, it gives you a resource. It's augmentation. It's not replacement. And what you're really doing is helping practitioners, and then they can talk to and engage with their beneficiaries. And in this case, in Gemma, that's the example that's in the book. So the real breakthrough is to begin thinking about how we use these tools. Now, what I'm going to tell you is, it's very important that we do that with bringing some of that evidence-based, rules, if you will, and principles of how we evaluate what works. So it's not correlation, is not causation problem, because we owe it to our beneficiaries and the practitioners on the front lines to have insights that we know really move the needle, that they're not just correlated. Gemma has been using this system now with real-time decision supports on the front lines for a couple of years now. And over that time, as a result, it's really helped them probabilistically nudge cases closer and closer to success, to the point where they're realizing 30-day reductions in treatment length. And to give you perspective, on average, and to give you perspective, that's helping practitioners reduce the length of stay. It's $10,000 a month for residential care and inpatient residential care. If you're serving 50 kids, you can see where this starts to benefit. They're also seeing a reduction in exit acuity, which they've got models and data that predict they won't be likely in 12 months to come back out of their homes or communities and placed in a residential setting again. So it's really helping practitioners make better decisions. And it's really helping them increase every practitioner one case at a time increase the odds of success while respecting each person's, kids, family's unique context. So it's not a one-size-fits-all model. So we're transforming evidence. And so there's ways to do this to make sure we do it without bias. And that's very important. That's the matching. There are also ways to look at identity biases and other issues of equity to make sure everybody's getting what works. So it's transparent. It's not using black box algorithms in these cases either. So these are just some things that have really been beneficial and the chapter is highlighting. The point being is that there are some approaches and technologies in AI that can take things to the next level.
Thank you for laying that out for us and taking us into the belly of the beast a little bit. It was really helpful to me. I'm going to circle back to you, Garrett. This is still the first question. We're a little behind time, but that's all good.
Oh, I missed that. Okay.
No, I think you answered a lot of the next question. So just think about what else you might want to add for the next question. But Garrett, back to you. What specific strategies have you found most effective for ensuring evidence actually meets the needs of frontline program staff and participants?
I'm always long-winded, but I'm going to try and be succinct here. There are many effective strategies, but the one that has always paid outside dividends in my experience is creating and nurturing proximity between researchers and evaluators and the practitioners, staff, and people being served. That closeness uniquely builds a deep level of understanding of people's needs and experiences. So historically, it's very true that good research can be done at arm's distance or more than arm's distance from the people and challenges we're studying. It's also true that sometimes building that proximity isn't possible because we're studying something retrospectively, or there could be time and capacity constraints that might mean closeness just isn't practical or possible. However, there are times when proximity is achievable, but there's still a philosophy that closeness and familiarity somehow can undermine a principle of objectivity that researchers strive for. Now, while I've seen and experienced folks getting so close, it has impaired their judgment or approach to methods, I don't buy into a blanket statement that all proximity and closeness undermines rather than improves our efforts. We have trusted mechanisms for ensuring we take a fair approach across the board to research that mitigates biases that can arise from, honestly, being too close or too far from the good work happening on the ground. So, for example, there's reasons why we state our assumptions and our hypotheses publicly and openly beforehand, and then we hold ourselves to those standards when it comes time to report the results. Did we prove something out or find a null or a negative finding? We need to be open to all those possibilities. And we as applied researchers and evaluators engage in reflective practice, solo with each other, and yes, even with funders, practitioners, beneficiaries, where we can interrogate our thinking and feelings during the course of study and adjust. So what might building proximity in practice actually look like when it's done well? At Year Up United, we built a stellar internal research and evaluation team that was originally embedded in the organization's program team. Further, all staff, including the internal research and eval team, were involved in some form of direct service. We're acting as coaches, mentors, and tutors directly with students engaged in workforce training. And by extension, we were in team meetings with program staff, members of learning communities, engaged in regular conversations with others who were wrestling with daily implementation challenges, some anticipated and many unexpected. The direct experience our team gained living out these challenges and helping to solve them firsthand made us so much better at framing and asking questions of our colleagues, peers, and students because they were based in real practical examples. And those experiences weren't only extractive, meaning that we were equally empowered to bring insights, intelligence, and knowledges back to our colleagues in real time. This was especially fruitful in live reviews of data, dashboards, debriefing study results. Our closeness built the valuable trust in the information we had to share, and we were better able to map insights to the very real needs others were facing. So this proximity, I'll say, and I'll digress on this point, can absolutely extend to other external researchers and evaluators who might be outside the organization or the place of study. I've got a great example to share on this front, but being mindful of time, I'm going to save it for the next question. We get a little bit deeper into the case study and book chapter, but I promise to revisit this exact topic then too.
Okay, that's terrific. Garrett, I'm going to stay with you for a second. Let's go to the next question on this and just talk about the professional training core evaluation, and specifically two elements, right? The partnership you built with Apt Associates and the University of Pennsylvania, and how you centered practitioner needs and realities in shaping your research questions and methods.
Sure thing.
Thank
I'll
you.
start quickly by sharing a little bit about Europe United. It's a large national workforce development enterprise and a leader in the skills first movement over the last 25 years. In over 20 cities nationwide, it's providing career pathways training by majority, but not exclusively, to talented young adults of color, ages 18 to 29, with a high school diploma or GED, but who are otherwise disconnected from a career path. It's offering talent placements through internships and well-paying career track jobs, as well as skills first practice consultation and advising with hundreds of companies, many in the Fortune 500. And lastly, it acts as an advisor and builder of talent networks with others in the ecosystem. So those are education, government, and civic institutions. Europe United sectoral training programs offer about 6 months, up to 6 months of classroom training in high demand skills, and then a 6-month paid internship with carefully matched corporate partners, and then placements into full-time roles after the program. These career pathways programs have evidence with really robust studies among the largest sustained increases in participants' earnings in the history of our field. You asked about our partnership with Apt Global and University of Pennsylvania. This was a relationship that benefited from carefully nurtured proximity built over many, many years of working together. I want to start by acknowledging the study teams. My former Europe teammate and co-author on the book chapter, Jess Britt, was my closest and most trusted teammate on the internal team. And we owe so much gratitude and appreciation for the external teams at Apt. We had Dr. David Fine, who's a principal associate and leading much of the study work. Azim Shivji, who did an awful lot of work as an analyst. Dr. Pamdan Suvana, who is a research associate. And the research team from UPenn are fabulous folks like Dr. Becca Maynard, who's a professor and head of social policy research, and Rebecca Balin as well. I met David and Becca, truth told, during my first week on the job 10 years ago, which goes to show you how important they are to Europe's development. When you're starting new at any job, like I'm going to be doing next week, you get hit with lots of asks for meeting and time, and there's a steep learning curve. They absolutely earned their way into like my first 48 hours on the job. That's how important and imperative they were to our study design and our overall research and evaluation plan. They played significant roles. David was a principal investigator on a large 2,500 person, 9-city federal impact evaluation Europe United did over, well, I mean, honestly, it started way back in 2010 and 11, and we're indeed expecting another report on this one next year. So this is like a 15-year thing that we've had the chance to develop this amazing relationship with these wonderful people. The time spent together definitely helped, but we benefited from a few other important things that made this possible. First, mutual proximity and trust. I promised I'd follow up on this one. David and Becca counted my teammate Jess and me as extensions of their study team, and we counted them as an extension of our internal research and evaluation team. They understood so well the inner workings of our program because they spent time with us, our staff, our leadership, our students. And we in kind were able to deliver against the study methods in the best ways because our in-house niche expertise and a respect for those robust methods and the study teams is something that we always wanted to deliver on mutually. I'd say secondly, in this chapter that's focused on, again, our professional training core, I'll say a little bit more about that unique iteration of our training program soon, but David, Becca, and the team were so willing to engage funders with us, which include an amalgamation of public and private sources. Like we stitched together multiple funding sources. The study featured in the chapter was only possible because we together were able to renegotiate a social innovation fund grant that was originally intended to be a randomized controlled trial impact study of one location that had very recently launched and honestly hadn't reached maturity enough yet to justify it being studied in impact fashion. We renegotiated that into a multi-site improvement study that helped us take an element of the program that I'll say a little bit more about and test a way to change it and optimize student retention in the program over time. That negotiation wasn't possible if our evaluation team wasn't right there with us, arguing for why it made sense to abandon the original plan that was crafted long before the program in that location even stood up and launched, into something that was practical and meaningful. Um, so that's yet another example of how that proximity and work together just meant so much. I mean, benefited from time, proximity, a shared and mutual respect for what would really be helpful and matter. The challenge at hand, and really how we respected the needs, was we crafted a list of possible research questions through input from our program teams. About a baker's dozen of possible topics, and we winnowed those topics down to what would be most fruitful and helpful. And one of the biggest challenges our professional training corps program was facing, and this is a co-located college model. That means that the usual experience of a Europe student that might get soup to nuts training and internship and everything hosted and served by Europe itself, they would dual enroll with Europe United and with a partner college so that their first 6 months of training in a classroom were being delivered by the partner college. They were credit bearing towards a degree program, and they carefully matched the job requirements of an internship and an eventual job placement. The one challenge, though, was that students were struggling in some coursework, and we might not have enough touch points during a semester. Maybe it was just a midterm or only a final degree in the college class to understand that a student was struggling. And so some students were wrestling with low course grades and indeed dropping out of the program. So we structured the study design specifically on that challenge that was upvoted by staff and was a very, very real limitation for a period of time of getting students to those high quality jobs. And in restructuring that study in that way to focus on a systematic program improvement one, we used familiar methods like a randomized control trial in a very, very careful way to iterate on possible strategies that could help improve retention. And so over the course of 2 semesters, we ultimately landed on a form of academic coaching that doubled down and focusing on course materials, tests, exams, quizzes, and assignments that ultimately yielded a 10 percentage point gain in student retention. Here again, the relationship with Apt and UPenn paid dividends because after that study that bore out and proved an effective strategy for improving retention was done, we got another set of funding from Arnold Ventures, thankfully, again, another great private source, to expand that study and to do long-term follow-up with additional resources after the program to see if that meant anything, if that improved retention meant anything to earnings. And indeed, we ended up finding that those who benefited from the academic and enhanced coaching methodology ended earning as much as we had evidence in some of our other large impact evaluations, which was thousands more dollars after the program because they completed the program start to finish. Again, Becca, David, and the Apt and UPenn teams were with us, again, start to finish on that entire project, including that communication of results.
Thank you, Garrett. Okay, Carrie, I'm turning to you. As someone deeply embedded in local government, you're working to build strong partnerships and advance equity and evidence within King County. Your chapter offers 5 calls to action for local government to support evidence building and use for a pro-equity future. I know we don't have time to dig into all of them, but can you share a couple of recommendations? And then, and just 1 second, Carrie, and then we're going to do some rapid fire questions because we're getting
Great
to the end.
Yeah. So I think rather than speaking specifically to any of the 5 calls to action that I have for local government, really the thread that's running through all of them is about creating a culture of learning, both within government and together with our research and community partners. And, just to kind of put some context around that, I think, traditionally, often in the past, we really approached evaluation as something that we would contract out, probably towards the end of a program. And we would approach the results as a judgment about an activity rather than a step in a process of continuous learning and improvement. And I've heard some of the other speakers here today talk a little bit about that. So that view of evaluation of a judgment as a judgment really creates so many disincentives for investing in evidence building. It often comes way too late in decision-making processes. It leaves a lot of questions on the table unanswered, and it can often have some really significant political or funding consequences, particularly if you end up getting a singular surprising result. So creating a culture of learning is really about broadening our focus from evaluation as a judgment about what works to really thinking about what works, for whom, and under what circumstances. And that broader view is really key to sustaining an equity-focused learning organization. It allows us to embrace and interrogate surprising results, like a null result, so a result where your study shows that you're not having any impact. How do you dig underneath that to really understand what we have to do differently to have the impact that we intend? That type of culture of learning isn't something that you develop overnight. It requires a sustained, intentional, and continuously nurtured environment. And it requires really all levels of leadership to really sustain it. And we often get questions from organizations or programs when we're starting out an evaluation about, well, what if we find out that we're not really having any impact? What's that going to imply? And of course, there's always nervousness around that, but when you're in a culture of learning, you can really embrace those null or negative results as a gift, right? Those are the most important results that we can find because they allow us to shift and move from creating harm to doing more good for more people more quickly. And that's what we're all in this for. So really thinking about that, the learning that's embedded in that is, and creating that culture of learning is, I think, the most important thing we can do.
I love that, Carrie. Thank you so much. Each of you have faced and overcome various challenges in implementing new approaches to evidence building. Pete, I'm going to turn to you. What can funders, researchers, and policymakers do to support this work?
I'm going to start. I'll keep this brief. I think that
you have time. It's okay.
It's okay. Yeah, no, I flipped some things around. I think that so the space that I was speaking to is really some of the newer technologies, AI in that piece. And I think that over the past 2 years, we've really seen advances in AI with respect to large language models, ChatGPT, all of that. I just want to put in a little public service announcement related to the use of AI. I have done a lot of work over the years on how these tools can work and how they can't work. And Gemma's a great example where we really approached it still through an evidence generation mindset that while I'm not a RCT and we were talking about, and Garrett gave some great examples of where RCTs can help us and also where they can't and the kind of reasons for that. I think that we still have to bring some rigor to what we're doing. And I just want to put in a little PSA here that says, listen, all funders and researchers and policy makers need to understand something really important about these large language models. I'm hearing a lot of stories where organizations are starting to have it analyze your data and draw causal conclusions or what works or asking it. I'm going to really put a PSA out there and say, please stop and cease and desist with doing that. Those large language models are correlational associational models. It really takes some approach, human in the loop, practitioners engaging, beneficiaries engaging, validation, face validity, the same things we do, even though these tools can help us really speed things up and do what we need to do. That brings me to the point of, I think one of the first things we really all need to do is understand what these tools are really doing before we start to use them and educate ourselves collaborate, researchers, evaluators, policymakers, and really start to collaborate and build the capacity to understand these tools. I fear that there's a lot of work going on, including vendors of administrative data systems that are saying they can actually do outcomes reporting. And yet when you look at it, it's kind of correlational, it's at best. So we have to be very, very cautious and careful. I would even say don't do it. Really bring the rigor that we've always brought to the evidence generation space. And lastly, I would just say, I think there are implications when we talk about, and a number of us have mentioned, figuring out what works for whom and under what circumstances. We're going to get better and better at that. I think it has policy implications. In the traditional past, we roll all of our data up to an average, what's the population, and then establish regulations and policies based on averages. And I think it's going to take a different kind of approach or thoughtfulness as to how we apply policies, regulations, funding streams based on different unique needs and different contextual situations. And so I think we're going to have to refine how we do policy making. So those are my three core comments.
Thank you so much, Pete. Garrett, do you have any, Garrett and Carrie, would you add anything else that you would recommend to policymakers, funders, and researchers?
Yeah, I can hop in. So, I think there's been this focus on RCTs as the gold standard for evaluation. And RCTs are absolutely great tools if they're applied to the right questions. But even an RCT can be really poorly applied, right?
Yep.
When I think about rigor, I think about building a rigorous theory of change, using rigorous quantitative methods, absolutely, and ensuring that we engage in a rigorous understanding of the findings. And that often requires that we're using qualitative methods and engagement of participants. So I'd really like to see funders support this broader range of activities that constitute rigor in my mind. And I'd also like to ensure that funding is built into evaluation plans that support the time and expertise of community participants. We should be paying them just like we pay consultants. It's also been really great to see clear guidance from the federal government that explicitly allows for evidence building as a grant-funded activity. And so it's really up to us as local governments to seize on this. And if you're interested in that, you can find that new guidance on the web. It was issued this April. So nice movement in a good direction.
Thank you, Carrie. Garrett, anything you would add? I know you talked a little bit about the blending of funding and the flexibility there being really important, but anything else you would add?
For sure. And both Pete and Carrie have given me some great stuff to build off of. This may sound familiar to many on the call, but I always find it's worth revisiting. Many of us want our very good intentions to equal impact. And so in that spirit, we're often assuming that the new thing, this could be totally net new or a change to what we've been doing in the past that's intended to help others, is absolutely going to be additive and helpful to others, but that may not be the case. And in the context of any study, and this can be a randomized control trial, or it can be something we're seeking to understand with other methods, experiential methods, deeply qualitative methods, it's really tempting to believe that if we withhold this thing from some people so we can understand and have a point of comparison to those who do get it, something different from business as usual, that there's a moral hazard and that we're doing a disservice to people by withholding this new thing. When in reality, we need to respect that that's a theory. It's a philosophy. It's a hypothesis that whatever we're doing differently, it could be a really great thing, or it might have a null effect, or it could actually lead to something negative. And maintaining that point of view and really adhering to that philosophy with discipline, and that means for practitioners, funders, and evaluators, is so important, so that when we go to implement, we know that we have to keep clear boundaries. And I think there are two ways that, at least with practitioners and donors, that I've experienced are helpful for getting there. first, drawing thoughtful parallels to other business cases to challenge the initial assumption that something new was just automatically going to be better, that intention equals impact. I mean, how many of us here on this call have adopted some new technology or data, for example, some of the large language model stuff Pete was talking about, to assume it's going to solve all of our problems. And then 6 to 12 months later, we're like, oh my goodness, that didn't solve most of what we were trying to figure out here. That kind of parallel that everyone can relate to, or most of us can relate to, is a quick way to convey the message that we can't make the same kind of assumption about the new intervention or thing. And then, like I've been saying this whole time, helping folks get proximate to the methodology and understand that if we don't keep some clear boundaries, it could undermine all the results, and maybe we've spent all this time and energy and indeed wasted it because we can't get a clear signal from the study. And nobody's out here trying to waste precious resources, in my experience anyway, at least not intentionally. And so that as well helps people get an appreciation and understanding for why keeping that boundary is so important.
Okay, fantastic, you guys. We have a little bit of time for some questions. So I'll field a few. And the first one, I'm not sure, let's see who would like to take it. How do you incorporate systems thinking into your work? And how do you help your teams, your organizations build capacity on the subject? Anybody want to tackle that? Systems.
I can pop in. I'm a systems thinker by nature, for sure. I think a lot of it goes back to some of the initial comments I made about really stepping back and thinking about how we're trying to build evidence and equity from the beginning. I think often when we bring an equity lens to the work, it automatically, maybe not automatically, but it pushes you to thinking more at a systems level, because so many impacts are influenced by systemic racism, the way systems are built to marginalize people. And so that can really help us unpack a lot of that. I think also if you're really thinking about theory of change, that's also helping you to think more at a systems level. In terms of how we, build capacity for this kind of thinking. I mean, this is a huge topic, right? We could have an entire hour-and-a-half webinar just on this topic, but it's hard. It's hard to find the time and the space for people to think at that level, to get up on the balcony, right? We get so embedded in, the details of our implementation. It can be really tough, but I think just as leaders, part of what we need to do is create that space for people. That can be one of our most important things that we do as a leader, is to help people get back up, think about community outcomes, think about the why, and think about all of the context around a problem.
Thank you, Carrie. Anybody? Well, I'm just in the interest of getting through all the questions that have come in. I'll jump to the next one. Could you please share strategies on how to engage beneficiaries into organizations so that they become true partners in program creation? I'm going to turn to Garrett for that, who's kindly offered.
Again, I'm privileged from getting to work at a place like Europe United, and indeed the future work at National Rec and Park Association too, because they both have great examples of this. If you're crafting something truly net new, I think whatever that thing is you're creating needs to start with the community, asking thoughtful questions and getting insight and input into what is the stuff we're trying to solve, and what seemingly has worked well or hasn't worked well in the past is a great jumping off point. So soliciting that input from the get-go is so important. In the case of actual beneficiaries being embedded in organizations, our research and eval team internally has always done our best to incorporate our alumni, our staff, and students directly in the sense-making process. And that begins with the asking of questions, the actual collection and analysis of results, and then spending time, and here's where capacity sometimes gets overlooked. We think we've produced the report or what have you, and now the process is done. But spending time with those results for sometimes months, if not longer, after they're crafted, is such an important step, and having students or beneficiaries directly involved is very important. Beyond that, organizational governance needs to include beneficiaries. We have historically had program alumni on our board of directors, even as our co-chair of the whole board of directors overseeing the organization with our executive leadership team. We strive to have participants and alumni on staff. At least 10% of the organization is a goal that we aim for, being actively involved in the delivery of the program in a multitude of functions, not all of them student-facing. Those activities of actually bringing folks on board as a part of the community and the governance of the organization are so valuable and important to including voice.
Thank you, Garrett. Okay, one last question. Earlier on, we talked about not only focusing on programmatic interventions, but also systems level change like policy and practice changes. Oftentimes, evaluating the impact of a less direct intervention is much harder and takes much longer. Do you have any ideas, recommendations, in 2 minutes, do you have any ideas, recommendations on how to study, measure, impact systems level change?
I'm happy to take a swipe at this a little bit here.
Thank you, Pete.
I think that it is very complicated. So first of all, I always like to differentiate. It's not a measurement issue. Oftentimes, if you get a group of folks together, as long as stakeholder agreement is there on the outcomes piece and what your measurements are, it's often posed as a measurement problem. It's not. The issue is an attribution problem. And so what you have to do is you have to start to bring, and this is where I think some of the bigger data that we're starting to see and some of the other analytics capabilities are we're starting to get into. Everything is very complicated. To move the needle on a particular systems indicator or some type of other community indicator or some other reflection of systems change quite often requires, there's a number of slices of the pie that explain it, if you will. And so the attribution problem is often a very big problem. So it's not a measurement issue. I think it's the attribution issue. And along those lines, I think there are ways now by collaborating with good data systems, technologies, tools, things like that. There's a lot of work being done right now in the space of what's called complexity evaluation, where you can start to bring more and more data sets together to understand how different systems interact with each other on different work that you're doing. That's a more data-driven answer, but at the big level, I always like to say it's an attribution problem. And the issue is you have variables that come into people's lives after a particular strategy or effort ends, and then we want to see how long the legs are outside of that. Time brings in confounding variables, new things into the equation. So we just have to acknowledge that. We can measure it and tell the story, but we have to be very careful about attribution because our methodologies are not very good at getting out there in time and trying to see if we're causally creating those systems changes. But I do think big data is offering us an opportunity, and machine learning and AI is offering an opportunity, as long as we involve people that are beneficiaries and everybody else in kind of how we interpret and translate them.
And with that, my friends, I'm sorry. I'm going to thank you for taking that question, Pete. And I just want to give a huge thank you to Michael, Carrie, Garrett, and Pete for joining us today and sharing their insights and their expertise. And thank you to everybody in the room for their questions and for being with us and for their interest in this work. Today's event is the first in a series of Next Generation Now conversations. There'll be short, casual conversations where authors discuss themes from their chapters and explore trends in evidence, philanthropy, policy, and technology. Our next conversation, which will be in about 2 weeks, will be around NextGen funding practices, and it'll feature John Brothers from the T. Rowe Price Foundation and Karina Wong from Craft Futures and formerly with the Gates Foundation. After that, we'll be discussing data ethics and bias, a really great topic. And we encourage you to stay tuned. Look forward to, we hope you'll join us for the future conversations. And with that, thank you all.
Thank you.
Bye.